Hello and welcome back to my channel. If you're new here, I'm Nurse Alyssa, a wound care specialist dedicated to helping you understand and manage all things wound related. In today's video, we're diving into a super common question. Should I keep a wound covered or let it breathe? You've probably heard both opinions, but the truth might surprise you. Let's break it down. For decades, people believe that exposing a wound to air helps it dry out and heal faster. But modern science says it's actually not the best approach. The most effective way to help a wound heal is to keep it clean, moist, and covered. Yes, that's right, covered, and here's why. Moisture equals faster healing. When you cover a wound with a proper bandage or dressing, it stays slightly moist, not soaked, but eyeball moist. And guess what? Moist environments help skin cells regenerate faster. It also reduces the chances of scabbing, and that means less pain, less itching, and less scarring. Protection from bacteria. Leaving a wound exposed can let dirt, bacteria, or other irritants in, especially if it's on your hands, your legs, or a place that touches your clothes. Covering it gives it a physical barrier, protecting it from infections, friction, and further injury. But doesn't air help it heal? It's a myth. Wounds need oxygen, yes, but they get it from your blood supply, not from the outside air. So exposing it really doesn't oxygenate anything. It just dries it out. When should you leave a wound open? There are a few exceptions where a wound might be better left uncovered. If it's a minor scrape and you're inside a clean environment, you don't need to cover it. If it's draining heavily and needs time to dry a little bit before the next dressing, you can leave it open. Or if it's advised by your doctor, especially for burns or surgical wounds, you want to follow their instructions. But for most scrapes, cuts, or even post-surgical wounds, covering it is the best way. So how do we cover a wound properly? So here's a quick step-by-step. You're going to clean the wound with a mild soap and water or saline. Pat it dry with a clean towel or sterile gauze. Cover with a sterile bandage or dressing. Then change the dressing daily depending on the amount of drainage or if it gets wet or dirty. You're now on your way to faster healing. So should you let a wound breathe? The short answer is no. Keep it covered. A covered wound heals faster with fewer complications and better cosmetic results. If you found this video helpful, don't forget to like and subscribe. And if you have any questions or topics that you would like to see in an upcoming video, please drop it down below. Until then, happy healing. Don't forget to visit my website, thewoundconsultant.com, for all your wound care needs. Whether you're seeking professional wound care consultations, access to high-quality supplements, holistic healing, digital resources, informative books, or high-quality wound care supplies, we have everything to support you. Whether you're dealing with a wound or you're a healthcare professional, there's something for everyone. Visit today and take the next step in effective wound care.